Today, I'm excited to introduce you to our new ESP co-host, who is Sam. We all call him Sam at the American Institute, and he is going to be joining me today really to help manage the discussion and any technical issues that we might have. So please join me in welcoming Sam.
Hello, everyone. I am Sam. I'm an English graduate, and I'm an administrative assistant at the American Institute. We've been working hard on this course, so I hope you will get to learn new things, and I hope you will have fun with Ariella. So, good luck, and Ariella, you have the floor.
Awesome. Thank you so much. Hi, everyone. Welcome to Medical English. We are at 470 participants, which is crazy. And I'm happy to see that so many of you guys waited for me. Again, I'm so sorry for making you wait. So let's just go ahead and launch straight into the discussion. Okay, so we are here at English for Special Purposes or Specific Purposes, week 3. My name is Ariella Knight. I am the founder and CEO of the American Institute. We are an English school and a cultural center in Algiers. I am originally from Boston in Massachusetts of the US. I went to school for undergraduate in Colorado, for graduate studies in Washington, D.C., and I have lived here in Algeria since 2018. My professional background is as a program manager, a business consultant, and of course, an English teacher. This is a class that we do every Tuesday night. There's 10 sessions, and the class is fully free to attend for everybody. There's 500 spots, and I can tell you right now, there are 489 of you guys here, which is just amazing. And these are recorded and posted on YouTube afterwards. So we've done 2 weeks. We've done the first week, which was an introduction to the course plus tourism English. The last week, which was week 2, we did tourism English as well with our guest, Noor Brahimi. And today we're doing English for health and medicine. As a reminder, this is a B2 level class. It's advanced intermediate. If you're finding it too challenging for you, that's okay. You can stay in the class, but I would recommend you watch the recording afterwards. The class, every week, we will have a different topic. It will be a combination of specialized vocabulary, skills development, and guest interviews. At specific points, I will ask you guys questions and you can participate in the chat or sometimes even via mic. So the chat, you are already using it, which is amazing. Please use the chat to respond to exercises, ask questions related to the topic, encourage each other. I might not see everything, but I try to keep an eye on it. How to use the Q&A, ask questions related to the chat, and some answers to questions we get every week. Number 1, there is no certificate for the class because it's an open class. We don't track who comes. And yes, this will be recorded and posted on YouTube later. We post these on 2 pages, the YouTube page for the American Institute and the YouTube page for the US Embassy. Class rules: respect and civility in the chat and when you're invited to speak on microphone. Be nice and be kind to each other, no profanity or discussing irrelevant topics, and help create a fun and positive learning environment. And these are my dog pictures. You guys, I promised I'd put a different animal, but I didn't find them. Sam didn't find them, so we're still with the dogs. So today's agenda, we did the welcome, overview of the class rules and the curriculum. We're going to talk briefly again, reminding you what is English for specific purposes. And then we're doing English for health and medicine. So before we even get into it, just a reminder, what does it mean to be in an ESP chat? I'm going to kind of go through this one instead of having you guys engage, just so we can get to the health and medicine part. ESP is a specific genre of English for students with specific goals. It focuses on developing communicative skills and the usage of English in specific fields, and is usually oriented to meet professional goals or is focused on a specific professional setting. Okay, that's why every week we have a different industry or profession that we look at. The benefits of learning ESP include professional development. Okay, so this is really more than a linguistic course, it is a professional development course because it gives you the vocabulary and the industry knowledge and the cultural knowledge necessary to enter different professional fields in English. You also have an opportunity to increase your communication practice. So ESP is based on using English that you already know, just in a new context or a specific context. So it gives a good opportunity to practice and use the English you know. Another reason to work on ESP is it will increase your motivation to learn English in a context that interests you. So really, I recommend that you come to the ESP classes that meet your specific interests. And this way, you are increasingly motivated to improve your English when you find the topics really relevant to your own life. So tonight, we might have with us doctors, nurses, healthcare professionals, dentists, pharmacists, or maybe just those of you interested in learning more about medical English. All right, so now on to English for health and medicine. That was my whole intro. So we're here going into health and medicine English. So now I have a question for you guys, and I want you guys to enter them into the chat. What is health or medical English? What do you think it is? And biologists, yes, welcome. What do you guys think is health and medicine? Medical terms, good. Medical jargon, medical terminology, good. Vocabulary related to medicine and health, specific vocabulary, simplified terms, medical field, biologist, communication. How to talk to patients, good. I'm glad to see that there. It's medical and scientific terminology, medical terms, diseases, veterinary, anything related to medical, okay, medical terminology, medical fields, medical knowledge. I saw someone say the word jargon, good. Okay, the terms you use at a hospital, words to describe people, formal vocabulary, okay, interesting. Okay, very good. So here's the definition we have. I think you guys nailed it. Medical English is specialized vocabulary used by healthcare professionals and clinical researchers. Next question. In what ways do you think health and medical English is different from regular English? Meaning, why do we need to study medical English to really understand? Why not just study English? Yeah, vocabulary terms, scientific terms, it's specialized, scientific words, understanding doctors, okay. To work all over the world, okay. I'm seeing some people put the reason they're studying, which is also interesting, okay. All right. This is really, I see a lot of, okay, I saw the word specific. Good, I'm happy to see specific. I see a lot of people saying it's scientific. So this question, maybe we didn't phrase it well, but we wanted to know what adjectives would you use to describe medical English specifically? What kind of English is it? Someone says it's more specific. Okay, it's more specific English. Someone says it's more difficult, professional, health-related, technical, accurate. Okay. Let me show you what we came up with. Number one is specific. You guys got it right. Medical English is very, very specific. It's very what we call exact. They find the exact right word for what they want to say. On that note, it's clear. Okay. So they prioritize clarity, not having a lot of descriptive language, and efficient, short. Okay, so when we're talking about medical English, someone said brief. We're looking for very short, efficient phrases that describe the situation or the problem exactly. Okay, when we're talking about medical English, and this is true both for spoken and written. And I'll talk a little bit about that later with written medical English, because this course is not a good format for us to do written English in. But this medical English, people who study medical English are often need to focus a lot on writing, because writing medical English is even more obviously unique in how specific, how clear, and how efficient it is. Good. All right, guys, now I'm actually going to invite some of you to join us on the microphone even before we get started, because I want to know, well, we've already gotten started, but before we learn some new things, because I want to know who we have with us. So if you are here and you have used medical English, I'd love for you to join us on the microphone. The question we have is, what do you notice about medical English that is different from regular English? Okay, so this can be anyone who's used medical English, but especially people working in the healthcare field. Okay, so I see people already raising their hands. The way that this works is if you raise your hand, you click the little raise hand button. I will select some of you at random, and you will turn on your microphone and talk. The request I have is just to keep your answer brief. Okay, so let's see who is going to speak with us. Hi, Ines, how are you?
Hi, my name is Ines. How are you?
We're doing great. I'm happy to finally succeed and have someone on microphone. Tell us, Ines, what do you notice are the differences when you're using medical English?
Okay, the difference between medical English and regular English is the technical terminology.
Okay.
We use
very good.
Exactly. We use in medical English a specific terminology of medicine.
Mm-hmm.
Like surgery, like nursing, like this about different technique of medicine, about different. Hello?
Yes, we hear you, Ines. It's good.
Okay.
That's very true. Very technical language.
About material of medicine at the block, operating block. About nursing, plateau of technical nursing, that different work at medicine, at the hospital, at different specialties of medicine, like like ophthalmology, like orthopedic specialist, like reanimation.
This is already a lot, Ines. Do you work in the medical field?
Yes, I work in medical field. I am anesthesiologist at the hospital.
Oh, amazing. Okay, and you're using English in your field?
No, in Algeria we use just French, Arabic and French.
Okay. Okay, well, Ines, thank you for sharing. We're happy to have you here.
Thank you. Thank you. I'm so happy.
All right. Thanks, Ines. Next, we will go to Asia. Asia, go ahead. Share with us. What do you notice about the differences between medical English and regular English?
The difference between medical English and normal English language is that medical English doesn't involve like feelings. When you are a doctor, you should be like how to say it, like when someone comes to you to have some help, yeah, I'm sorry, I'm stressed.
No, you're doing great. You're doing great. Someone comes to you maybe for treatment, when a patient comes to a hospital.
Yeah, the doctor shouldn't be like your mom or your friend. It should be like but medical
maybe
English
more formal.
must be direct. Yeah, direct. So I'm using it. I'm not a doctor, but I'm using medical English in my thesis because I'm an artificial intelligence student.
Mm.
So I'm doing my thesis in a medical way, like prediction of the awakening from coma. I'm trying to
Oh my
do
God,
that.
that's crazy. That's so cool.
Yeah, so the English that I'm studying is like technical, direct, and concise, like we said earlier in your courses.
Concise, exactly. Okay, very cool, Asya. Thank you so much for sharing.
You're welcome. Thank you.
Okay, I love that. We had an anesthesiologist and an AI student about researching about people waking up from comas. Okay, that's very cool. I think we'll stop there because I really like both of those stories, and it seems very hard to find people with a good enough connection. But you guys both did great. And what I like is that you found two very different things to highlight, which for me is very important. One is vocabulary and one is culture. I don't just mean culture in terms of, you know, an American hospital versus an Algerian hospital or a Chinese hospital, but I mean like the culture of an industry. And the culture of an industry can actually be somewhat similar across cultures. And I think that most cultures have a little more formality in the medical field, or when you're in a hospital, or when you're speaking to a doctor or speaking to a medical professional, that you feel, I don't know, slightly more formal or slightly more I don't know, it's the environment changes the type of language that we use. So just like Asya said, you don't explain your problem to a doctor the way you describe it to your best friend or to your mom, right? You come a little more composed, you're prepared to speak. In fact, it's not always very friendly. I wanted to point that out. It's more formal, but sometimes, especially in the US, doctors have been criticized for this, which is that they're not necessarily warm and sweet and take a lot of time with you. They can be very cold and professional and precise, right? So they come, they diagnose the problem, and they leave. So it has that sort of formal environment to it as well when it comes to communication. But that's not true for all doctors. I've definitely met some very wonderful, friendly, supportive doctors as well. But in the US, the profession has a stereotype of being like that. All right, you guys, cool. So now we're gonna start our first exercise. So I know a lot of you are here to actually learn the vocabulary for medical English. I want to say something about all of these ESP classes just to set your expectations. If you truly need to master medical English, an hour-and-a-half class is just not enough, okay? What I hope this class to do for you is to motivate you to understand how big the field of medical English is so that you can continue your learning. There's many subfields that you can continue learning in medical English, whether it's specialized vocabulary or scientific writing. So today we're going to go over some of the most general terms in medical English and try to make it fun for you. So you're learning some vocabulary about diseases, about symptoms, about equipment, but you should go walk out of here not feeling like, oh, halas, I know everything. Instead, you should think, wow, there's a lot of vocabulary to learn. Let me start following some of my, you know, some YouTubers who talk about medical English or learning English for the medical field. This should just be the beginning or one piece of your journey to mastering medical English. Okay. So everyone in the chat, what is this? Oh, someone put an answer that is not spelled correctly. Okay, stethoscope. Very good. I see it written in many ways and sometimes with accents, which makes me think perhaps it's the same word in French, which I didn't know. This is the correct spelling. And we pronounce this as stethoscope, stethoscope, not stethoscope. And be careful that we do pronounce the TH, stethoscope, okay? Awesome. Oh my gosh, this is gonna be easy. Look at all of you guys know. Number two, what's this? First aid kit. Very good. I see some people saying box. I see some people saying emergency. Really, my preferred term is first aid kit. Okay, a kit is a name for something that contains many other instruments. It doesn't just have to be first aid. Like when you go camping, you can say it's my camping kit. It means it has my tent, it has my, outdoor stove. Okay, so a kit is a name for something that contains many smaller things. This is called a first aid kit. I really prefer just this term. I know that you can say, oh, it's an emergency kit or a survival kit. It's not commonly known by that. I want to emphasize for you guys, first aid kit is the correct terminology, and you will be best understood if you use this. Okay. What is this? You guys get these really? Are these all French words? Okay. I see two things happening. I see a bistouri and a scalpel. Maybe I should send a little poll. I'm gonna say medical knife, medical blade. How many people here are busy watching ER and other hospital shows, Grey's Anatomy? That's a pretty good tool for learning these terms also. This is a scalpel. Okay, The Good Doctor. I mean, honestly, I recommend these shows to my students who want specialized vocabulary. I say, go watch the show. If you're a lawyer, watch the legal shows, doctor or medical professional, watch the medical shows. Okay, it's a scalpel. All right, and we do say the L, scalpel, not scalpel. It sounds like you're missing it, but you're not. It is in there, scalpel. It's funny that you guys we're doing pronunciation with my voice like this. I hope you can actually hear all the words coming out of my very scratchy throat. What is this? I see three different words. I see needle, I see injection, and I see syringe with a lot of different spellings. And someone says a shot. Okay, interesting. This is a syringe spelled with a Y, not an E, S-Y. Okay, we can technically call it a needle. All right, but when you say needle is a general term. So when you sew clothing, that is also called a needle. It's not as specific as syringe. Syringe has a needle at the end, but it also has the liquid that you put into it. Okay, so syringe is the correct term. Injection is the name of when you get something inside of you. It is not the name of the equipment. Okay, the equipment is the syringe. You make an injection with a syringe. I saw one more, which is shot. Shot is similar to injection. You use a syringe to give someone a shot. Okay, this is my little imitation of the syringe. Okay, all right, very cool. Next, what is this? I'm excited to see what you guys say for this one, because actually Sam and I had a discussion about the accurate medical term and the term that is actually used. And I don't think anyone got it right. Artificial, very good. Did you guys see what he put? I'm seeing a lot of serum. All right, well, Salim, you gave us the really long one for it. But for people, I'm realizing on the recording, they're not going to see the chat. So everyone is putting serum. People are putting really serum over and over and over. Hanging bag, saline fluid, perfusion. Okay, this is what we call an IV or an IV bag. There is another answer that I would have accepted. That answer is saline. Okay, saline solution. Saline solution or saline bag. This is a technical term that doctors might use because that's the name of the fluid inside the bag. It's saline, right? It's just rehydration. But we in English, we almost exclusively refer to this as an IV. Okay, an IV. We don't even say bag. IV just means intravenous, but this is the term that we use. So you'll say to someone, oh, I got so sick, I had to go to the hospital and they gave me an IV. This is the term that is commonly used to refer to this. If you go to a hospital in English and you start talking about a saline serum, you might sound like you've read the dictionary, but they might not exactly instantly know what you're referring to. Okay? IV. This is what we're talking about, is an IV bag. I see someone saying, like, what if it's not saline? What if it's something else? Exactly. This is why we call it an IV. An IV just means that you have had this equipment run into your veins. You say, I had an IV. Okay? What is this? You guys, IV means intravenous, meaning within your veins. These are veins. These blue lines are veins. I don't really have any obvious veins. I'm not very veiny. What about on my hand? That is a vein. Okay? Intravenous means within your vein. But I wouldn't, I mean, of course, if you're curious, you can know that. But I bet you'll meet a lot of Americans who don't know what IV means. Okay, I see some of you have already moved on to this next one. Very good. So we have people saying stick, we have crutch, we have picket, we have cane. Anything else? Stick. Did I say stick? Okay. Not a lot of guesses for this one, actually. Maybe this is the one that most people don't know, but some of you do know it. This is a crutch. When you have two of them, it is called crutches, okay? And this is what you take when you have hurt your leg and you can't walk. Maybe you have a cast on one foot, a broken leg. There's also some new models of crutches as well that are a bit lower. They don't have the part that goes here. They just have the bottom part. You hold it with your hands. These are still called crutches. Again, crutches singular, crutches is plural. What is this? Yes, even the wooden ones are crutches. Well, hold on a second, but these are not canes. A cane is something different. Just trying to keep my throat active for the remaining class. Okay, I see bandage, I see plaster, I see cast, I see plâtre. We know that that's not English. I see splint. It's actually not a splint. All of these are actually English words, but they're different things. This is a cast. So when you get this, it is made of plaster. For those of you sharing plaster, that is the material, but the final product, once it has hardened around the broken bone, is called a cast, okay? And that is the only word for this, cast. Bandages is not the same thing. It does not include something that you've, that has hardened around you, okay? But yes, bandage is an English word. Bandage is like when you wrap something when you're bleeding to stop the bleeding. You bandage it with a bandage. Cast is something the doctor makes and it's permanent. And the only way to get it off you, usually the doctor, they either cut it with special scissors or they drill. Has anyone here had a cast? Yeah? Reem has had one. Abdallah has not. Yes, no, 2 times. 2 times. When I was 10. No, 2 times at once. Oh no, 3 times. Oh, a lot. Fortunately not. Okay. Yes, so I have actually never had a cast. I'm with you guys who maybe were more careful, or I don't know, maybe we're just less spontaneous, but I've only broken 1 bone once in my foot, and they did not put it in a cast. They put it in something that we call a boot. which holds the foot, but it does not bind it. You can take it off at the end of the day. Okay. Oh, that was everything for our terms, okay? So we had cast, crutch, IV bag, syringe, scalpel, first aid kit, and stethoscope. Seems like you guys know a lot of these. So we're ready to move to something harder. Now we're gonna do common medical English terms. I tried to come up with a list, along with Sam, of really common symptoms. So the symptoms means this is not the name of the illness. This is something that you experience because you have an illness or because you are sick, okay? The first one is a sore throat. That is what I have right now. A sore throat means your throat is, usually it means it's inflamed, it's itchy, it makes you cough, it can hurt when you swallow. Tell me, what do people think? Thank you guys, you're so sweet. What happens when you have a sore throat in, or not what happens, what diseases give you a sore throat? COVID. Yeah, COVID gives you a sore throat. Flu, very good. Very good. People are saying angine. Angine in English is strep throat, okay? For me, not drinking water. For me, I'm almost positive I got this from bad air conditioning, which is a little bit gross. Thank you guys so much. Thanks for your well wishes. Yeah, Selma, very good. You can just get a sore throat from having a cold. Exactly. Okay, awesome. Next is a cold, which is what we were just talking about. I have 2 bonus questions. When we say a cold, there's actually 2 ways in addition to this to say a cold. They're a bit longer. They have the word cold in them. Does anyone know what they are? You can say, I have a cold, or I have, I see flu. No, it's another way to say I have a cold. It's basically you add a word. Okay, someone said a seasonal cold. This is very close. I'm going to give you guys another minute to see if anyone can guess it. I have a cold. It's not the flu. Seasonal cold, a little bit. Catch a cold. Okay, well, I'm happy to teach you guys something then. So there's 2 other ways to say I have a cold. They mean exactly the same thing as a cold. Number 1 is the common cold. We say this. We say, oh, I have the common cold. You know, you can say to someone, imagine I meet someone and I say, I have a sore throat. And they go, oh, what is it? I go, it's just the common cold. All right, it means I have the symptom of the sore throat from the common cold. That's what's going around. Salim got the second one, a head cold. Good. So we either say common cold or we say head cold or we say cold. You have 3 options. The only difference is when we say common cold, it is definite. It is the common cold, a head cold, and a cold, okay? The only one that is definite is the common cold. I have the common cold, or I have a head cold, or a cold. Yeah, we say head cold, I think, because it's felt here, it's in your sinuses, it's in your throat, it's in and around the head, but it's kind of dumb because a cold is the same thing. It's just another word for the same thing, you guys. There's no difference. They mean the exact same thing. A head cold, the common cold, and a cold. Keef, keef, keef. All right. Some of you are asking, what are these? What is a cold? So a cold is basically the most common illness you can get, where you get sick usually in the winter and you have your nose is running, right? So you need to blow your nose in tissues. Sometimes you have a headache from your sinuses and a sore throat. Me, I may just have the common cold right now. It's very possible. Okay, next is a fever. What does it mean, fever? Yes, when your body temperature is higher than normal. Okay. Someone also said a hot head, which I really like, because a hot head means you feel this and it feels hot. You say, you know what? I think I have a fever. All right. It's funny though, because a hot head is actually a term for someone else. Hot head is someone who's overly confident and kind of brash. So I understand the context because it's in medical English. Like I know that what you're talking about, but this is not the term you want to use for fever. Okay. High temperature, high body temperature. Good. What about headache? What is a headache? Pain in the head, head pain. Head pain, head pain, head pain. You guys all got it. A headache is a pain in the head. Okay. And you do this often. You see people in movies, and probably I do it sometimes. Maybe you do it, where we go, I have a headache. Okay. Very good. A stomach ache. What is a stomach ache? Pain in the stomach. Yeah. So you guys, I think, are seeing a trend here, which is the word ache. Ache is something that hurts. Okay. You can have a headache. You can have a stomach ache. You can have a backache. I have a backache. You can have I think that's really everything we have that aches. I don't know if we say my arm aches. If you have an injury, so imagine that you have an injury. Oh, an earache. I saw someone said earache. That's definitely true. You can have an earache. Okay, I see you guys kind of spamming the chat here. I'm going to just try to do something about it so I can still see. Hold on one second. Okay. A toothache, very good. An earache, a toothache. Look, you guys know this more than me. Throat ache, we don't say. We only say sore throat, not throat ache. Abdomen ache, no, we don't say. We say stomach ache. But I was going to say that if we have an old injury, say we have like a broken bone and it heals, but maybe it doesn't heal 100%. Or do your grandparents ever say like, oh, when it's raining, their bones ache? So sometimes in those contexts, you can say like, oh, my arm aches, if you're talking about the bones of like an old injury, okay? All right, next we have chills. What does it mean, chills? Yes. Okay, I saw someone saying chills is chair de poule, but I think chair de poule is just goosebumps. We call it goosebumps when your hair stands up. Chills is a medical term. Chills happens when you have a fever and you shake all over and you often sweat. Okay, so you're sweating, you're cold. It is a medical term. It's not just feeling cold. It usually means that you have a fever and therefore your body is not able to stay hot. Okay, so it is shaking and sweaty. Okay. A cough. I'm thinking I could cough for you right now. This is why I'm smiling. A cough is, someone said, ahem, ahem. Someone else said, a human bark. You guys are so funny. Yeah, I'm going to just show you a cough. Okay, which you're not supposed to do in your hand anymore since COVID. Remember, we do this. We cough in our elbow so that we aren't, spraying the disease very far. But yes, that is a cough. Dizziness. What is dizziness? Yeah, you guys are doing like a great job of sharing in the chat. I love it. Oh, vertigo. Yeah, feeling imbalanced. Vertigo. Very good. We have another term for dizziness, which is the spins. I have the spins. Ooh, I have the spins, right? Because it's the world spinning around you. Yeah, very good. Dizziness, you feel like you're going to fall. Good. Swelling. What is swelling? Increasing in volume. Okay. Swelling is something getting bigger. Swelling is an allergic reaction. It's not a bruise. Inflamed. Okay, you guys are kind of getting there. So swelling is when something is getting bigger, usually because you just hit it. So if I hit myself really, really hard and I look a few hours later, I might see a bump and I go, ooh, it's really swelling. And every hour it swells and swells. When we most often talk about swelling is really like in movies you guys have seen when somebody gets punched in the eye. And it takes a while. It takes maybe an hour until it starts to swell. And when it swells, sometimes so much, it pushes the eye closed. It's really, really big and swollen. This is the adjective, swollen, until your eye is shut. And you say, wow, look at the swelling. Okay. So this is swelling. We often have swelling for, the more common areas to have swelling, I would say, would be on your face because it's so sensitive. So if you sort of accidentally hit yourself in the mouth or the face or the eyes, especially because people are looking at that part of you when they talk to you, they'll say, wow, you're really swelling up. And it's always after an injury or like an operation. A lot of times after you do an operation, a doctor will say to you, expect some swelling. Okay, it's the body's normal reaction to try to heal something after a surgery or after being hurt. Okay, and then we have a stuffy or runny nose. These are two different terms that you can use, and they're slightly different. Stuffy or runny. Mucus, good. You guys are funny. A nose full. I'm just gonna say, maybe I shouldn't say this as a teacher, but I think it's funny. A nose filled with boogers. Someone sent in. Yeah, you need, which by the way, you guys, just to be correct, booger is spelled with 2 O's. If you say it with a U, you're saying bugger, which means something different. It's like a British term. Okay, so a stuffy nose is when you cannot breathe through your nose because it is full of, we can say mucus is the medical term. We can say snot or boogers as the non-medical term, okay? Yeah, so airless, you can't breathe through, okay? Runny nose is when it's really a lot of liquid coming out of your nose. That's when you have to blow your nose a lot because it's running, okay? So these are not synonyms. These are 2 different things. So maybe we would say, I have a cold and my symptoms are a sore throat, a cough, and a stuffy nose. And then the next day I say, well, I still have the cough, but now I have a runny nose. Yeah, I would spend the whole day running. I have a tissue here running and doing this. And I'm actually sick on our episode, but I also don't want to gross you guys out by demonstrating everything. Okay. The last one, fatigue. This is easy. It's the same word in French. Tiredness, zero energy, exhaustion. Very good. Tired, weakness. How I feel knowing I have a lot of vocabulary to learn. That's funny. Yeah, fatigue is just a medical term for being tired. So this is a classic example of how medical English is different from regular English. When you're talking to the doctor, I mean, sure, you can say, hey, doc, I've just been feeling so tired all the time. When the doctor repeats it back to you, he may say, how long have you been experiencing fatigue? Okay, he might switch it for the more formal, more medical term. Okay, you're welcome to say that as well. It's very normal as well for the patient to say, I've just been having so much fatigue. Okay, but it's also, I would say, more common that in the medical terminology and when they write the notes, they will use fatigue instead of tiredness. It's the more formal way of saying tiredness. Okay, guys, now we are on to infections, and I'm not exactly sure how I'm going to describe all of these, so we're going to try our best, okay? Some of them should be easy, but some of them might be a little bit hard. Okay, an infection. What is an infection? This is easy. This is also in French. Oh, sorry. I meant to tell you, we've changed slides. So the last slide was symptoms of diseases. This slide are the actual diseases. Okay, these are names of diseases. And I tried to pick, and Sam and I tried to pick common diseases. Okay, these are very common. So an infection is usually when you have you can have a bacterial infection, meaning you have bacteria in your body that does not belong, or you can have a viral infection. This is from a virus. Okay, but in either way, your body is having a reaction. I think we have doctors in the chat giving me like the more appropriate or medical way to say it, which is infection or inflammation caused by microorganisms. Thank you to all the doctors here giving me that background. But the common terms that we'll use are going to be viral infection or bacterial infection, okay? And within that, that's a broad term. There's so many illnesses, okay? This is the overall term for infection. The flu, I think you guys all know what the flu is because during the cold, you were always putting it there. Yeah, influenza. Yep, the flu goes around every year. What's a very famous flu that we're all dealing with right now? Something that has caused a pandemic, perhaps. Yeah, COVID-19. I made it too easy. But yeah, COVID-19 is a flu. We have the flu every year. It comes around, usually a different variety from the one in the last year. And COVID-19 is a flu. Okay, very cool. Pneumonia. Who knows what pneumonia is? And please pay attention to how I pronounce this. We do not say the P. We call it pneumonia. All right. Yes, pneumonia is a lung infection. Usually pneumonia happens if you have, or not usually, I guess, but in my particular case, and I'm not a doctor, the times I've gotten pneumonia have been when I've been sick for a long time with a cold. I have a common cold. It stays, and then it moves into the lungs. And that's when you have pneumonia, and it can be very serious. Okay. Allergies. What are allergies? Being sensitive to something, having an excessive reaction, irritation, hypersensibility, things that our bodies cannot stand, not support, things our bodies cannot stand. Good. Allergies are relatively common, meaning that a lot of people have something they're allergic to. You can have an allergy to pollen, right? So every spring you're blowing your nose because you have a reaction to the flowers blooming. You can also have food allergies. You can have, common ones are to nuts and seeds, but you can really be allergic to everything, to anything. So this is a very common term that you should know. Conjunctivitis, this is less common. Conjunctivitis, oh, you guys all know. Well, this is the thing about medical English. Oh, for people in recording, I should say everyone is writing eye infection, inflammation of the eyes, which is exactly right. Conjunctivitis, one of the reasons I'm including it here is because you can start to see a trend in English medical terms for diseases, which is itis, I-T-I-S at the end of the word. This is very common for different diseases. We have conjunctivitis, we have appendicitis. I don't have any more on the top of my head. If you guys know any more, please send them in. But these are also common in other languages. So you'll find a lot of these terms overlapping with terms in French. So once you get into the more technical medical terminology, you might actually find that it's easier for you than the common terminology. An example of this, conjunctivitis is the medical term. Does anyone know what we call this in English? It's kind of a nickname for conjunctivitis. I will be very impressed if someone knows this. It's very, very rare. Ooh, Iman, you're so close. Ah, wait, someone got it. Someone got it. Abdallah, pink eye. Very good. And Walid, pink eye, and Abir. Amazing, you guys. We call this pink eye. This is our sort of like nickname for conjunctivitis because it's so common. I think everyone gets it as kids, and your eyes look very, very pink. Okay, diabetes. I mean, I think diabetes also is, oh my gosh, you guys are ready for this. Blood glucose is too high level of sugar, chronic disease with high level of sugar, level of glucose in the blood. Very good, diabetes. And then the last one is high blood pressure. I saw someone say, you have sweet blood. I just want to tell you quickly, that sounds like you're a vampire, because sweet blood indicates that you've tasted it or that you want to taste it. So you need to say they have a high level of sugar in their blood, but you cannot use the adjective sweet, or else, you know, we're going to think you've seen a lot of True Blood, a lot of Vampire Diaries. All right, high blood pressure. Yes, hypertension. You guys are all right. Blood overdrive. Yeah, very good. So these are some of the really common illnesses. Now I want to move to some of the kind of like top illnesses in the world. Oh my gosh, Asya said, what about mental diseases? I'm so glad you put that there. Those are coming in next week. So we're only this week talking physical diseases, but I'm really happy you said that, because health and medical English also has to do with mental health. You'll notice we're also not talking about dental terms right now or pharmaceutical terms. We started with very common medical English terms. So now I want you guys to share, and I don't know if we'll go on mic because it's very hard to find, you know, the good connection. So I think we'll keep going with chat. I want you guys to tell me, what do you think are the diseases that have killed the most people in the world? This is in all of history. So not actively today. You can include ancient diseases. Okay, I see flu. I saw someone say stress. Oh, so stress is not technically a disease, but I hear you. Depression, obesity, malaria, plague, cardiovascular disease, tuberculosis, Black Death, depression, corona, Ebola, AVC. Okay, how do we say AVC in English? Does anyone know? SARS, COVID. Stroke, very good. An AVC is a stroke. I saw someone else ask a question. HIV, AIDS, very good. We don't say SIDA. SIDA is a French acronym. We say HIV. Someone else asked a question. Oh, how do we say la peste? Who knows how to say it? The plague. We actually have two terms for it, the plague and Black Death. You guys are so good. You don't need me. Asala, thank you for sending it. Black Death or plague, heart disease, cancer. Okay. These are diseases that have killed the most people in all history. Sorry to depress you, but they're good words to know. The bubonic plague. So that is also called the plague. It's also called Black Death. Or the technical term, which is bubonic plague. Okay, so you should be pronouncing it the bu, like as if there's a y after bubonic. Okay, that is the number one in all of history. Number two is, excuse me, influenza or the flu. Number three, I didn't see anyone guess cholera. Did anyone guess cholera? Oh, Manel guessed cholera. Now that I'm scrolling up, actually, Manel. Oh, and Fatima. Oh, sorry, you guys. I didn't see all these good ones. Okay, so cholera, very good. Smallpox, another historical illness that does not exist today. And typhus. Okay. Does everybody know what all of these are? Bubonic plague. Yeah, next time maybe we should add the numbers, because I want to know like how many people did get killed by these different diseases. I have no idea. Okay, so let's see. Typhus, I don't know how to describe typhus. Typhus is like a fever. Typhus fever, it doesn't really happen very much anymore. Oh, Yassine is telling us it's in contaminated water. It's one of these illnesses that we don't have as much in modern day, but at the time was really, really killer. They were like lung infections from bacterias with, I think, headaches, rash, and then death. They're pretty severe. Getting typhus was deadly, as we're calling our list, diseases that killed the most people. Smallpox. So anytime we're talking about a smallpox or a pox, it usually has to do with a disease that causes an irritation on your skin. Okay, and usually we call it pox because they have dots. Okay, you see something with red dots on your skin. This is almost all of the pox terms that we use. I mean, at least chicken pox and smallpox, they have to do with this. And you would have fever and die, I think. Where are the doctors? Next session, we're getting a guest doctor, and I'm going to have the doctor share all of the answers to your medical questions. My focus is just to teach you the terms in English, all right? Now I have a new question. Which diseases are most fatal? This is different from the ones that have killed the most people in history. This is in current day, which diseases are killing the most people now? Or perhaps, if you get it, you're least likely to survive. Cancer, AIDS, cancer, leukemia, COVID, heart attack, heart disease, hypertension, heart disease, cancer, stroke. Okay, pancreatitis, obesity. I see a lot of people writing obesity, cancers, diabetes. Okay, so we have number one is cardiovascular diseases. So everyone that put in anything about hypertension or heart disease, that is the number one killer. This includes heart attacks and any sort of heart disease, which they do often link a connection with like extreme overweight obesity. Infectious diseases, this includes HIV/AIDS, you guys got it right. Diarrhea, again, from cholera, tuberculosis, which is still active today in parts of the world. I know a lot of parts of the world no longer have tuberculosis, but a lot of parts do. Malaria and measles. I feel like you guys are going to ask me to describe measles, and I'm just going to try to think, how do I describe it? Measles is a respiratory illness. I have to admit, I just looked it up. But we get vaccines for these now. There's a measles vaccine. There's not exactly a cholera vaccine, and there's not an AIDS vaccine, but there is treatment. So it could be possible in a few years, in 10 years from now, that HIV/AIDS would have moved much further down the list, because now people can live for a very long time with HIV/AIDS. And I saw someone say that people in Algeria have tuberculosis. Yes, people in America have tuberculosis. It's just way less common than it used to be. A lot of parts of the world have eradicated it. We have a much more sophisticated treatment for it. Awesome. Thanks, you guys. Now I have a guess the meaning. All right. I think this is one of our last few vocabulary. So we have on the left a list of 5 different expressions. Okay. And on the right, we have definitions. I want you to match them. Take a few seconds, okay? Don't rush into the chat. Take a second. If you have a pen and paper, these are great terms to write down. A lot of them are more informal or like idiomatic language. And then we'll share them at the end, okay? So take a few seconds. I'm gonna pause talking and let you guys. All right. I hope some of you didn't look at the chat and actually did it on your own, because the chat, you guys were giving it all away. Number 1, a silent killer. What does it mean? Good. A silent killer is a disease that has no obvious symptoms. Sometimes people talk about heart disease this way, okay, because you might not know for many years that your heart is building fat around it until it's too late. Another silent killer, well, actually, the biggest silent killer that people talk about, or that is sort of common to talk about today, are things like stress. So things that you wouldn't necessarily think of as a disease, but that can lead to ill effects on your health. And so there'll definitely be like news articles or magazine articles out there that will say stress, the silent killer. All right, number 2. Stage 1, stage 2, stage 3, stage 4, yes. I think this one was probably the easiest. Levels of biological severity for specific diseases. So we most often hear about this with cancer. Unfortunately, or sadly, I should say, if you guys have ever known someone who's been diagnosed with cancer, when they get the diagnosis, they also receive a diagnosis of what stage they are at. So they'll say, I just got diagnosed with stage 2 lung cancer, okay? As you progress in the stages from 1 to 2 to 3 to 4, the disease is getting worse. So stage 1, when people say, oh, it's stage 1 cancer, the reaction is, thank God you caught it early. I'm so glad they discovered it, okay? Because it means they've caught the cancer at a very, very young stage. It's only just started. When someone says they've just diagnosed me with stage 4, maybe stage 4 breast cancer, that's when you say, oh my gosh, because that means it's already metastasized, it's already in other parts of the body. And usually the diagnosis, or I should say the prognosis, which means how likely the person is to recover, is negative or is not very positive. Okay. Itchy. What is itchy? To go from like the most serious to the least serious. To be itchy, an uneasy, irritating sensation. The thing with that description is it doesn't really picture it. Like, this is the type of word that needs to be described by showing. So when something is itchy, you do this. Ooh, you itch. So the verb is to itch. And the sensation that makes you want to itch is itchy. So when we put on a jacket, when we put on like a coat, maybe it's made out of wool, we go, oh, it's an itchy jacket, meaning it's irritating my skin. It makes me want to do this. Also mosquitoes. Mosquitoes bite us and they leave a bite and we go, I'm so itchy, I'm so itchy. Okay, this is itchy. All right, benign. What is benign? Yes, benign is B. So benign, a mild type of character that does not threaten health or life. Benign, oh, Nesrine, you answered for me. I was gonna say, what are we usually describing when we have the word benign? We'll see if anyone else gets it. Tumor, thank you. Abir and Nesrine who put it up first. So when we are talking about something being benign, we are usually talking about a tumor. So someone will say, you know, the doctor, like, we found a lump. This is what we call, you find a lump. This can happen when you're doing a diagnosis for cancer, and you go, maybe you find a lump in your throat, you're feeling it, and you say, oh my God, I think I have a lump. You go and the doctor will do usually an X-ray scan, okay? And then sometimes what's called a biopsy, okay? Where they will take a piece of the tumor and analyze it in the lab to see, is the tumor cancerous? Mani's asking, what is a tumor? A tumor is a lump, right? A lump of cells that grows in your body. So it can sometimes physically show up, okay? Other times you can't see it, but you feel it. It can be anywhere. So I'm using the example of a lump in the throat, but it can be anywhere. Excuse me. So benign is when the tumor is non-cancerous, okay? It's just a tumor. It's just a lump of cells. There's nothing dangerous about it. Okay, at least nothing inherent to the cells. Good. Blood count, the last one. D, very good. So blood count is the determination of blood cells in your blood. So when you come into the doctor, especially if you're reporting certain symptoms, maybe like fatigue, they'll say, let's get your blood count. They will take some blood, you know, usually with a syringe or with an IV bag, and they will analyze it in the lab, and they can come back to you and they'll tell you what is your count of red blood cells and white blood cells. This will show them if you're fighting a disease or if you're, you know, maybe can help diagnose a problem that you're having. But that is what it means when the doctor says, I'm looking at your blood count. Okay. Number 2, same exercise, you guys. We have 5 new terms and 5 new definitions. Try not to look at the chat. Do it on your own before you look at the chat so you have time to read the definitions, analyze it, and then come back. And I will be right back on screen. All right, let's start. Number 1, blood pressure. Blood pressure. Noor Al Huda, there is no certificate. I see your question. There is no certificate. Blood pressure is B. Very good. The force of blood pushing against the walls of your arteries. This is very scientific. But what I want you guys to think about when you hear blood pressure is the blood pressure test. When you see the doctor, they always, always, always take your blood pressure. And they usually do it by putting what we call a cuff that I just put in the chat, a cuff around your arm, and then they pump it, right? They pump it until it's tight, 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 tight. And then they release it and they measure your blood pressure, okay? Having high or low or regular blood pressure is an indicator of your health overall. CPR, what is CPR? D, exactly. So CPR is a manual technique used to save someone whose breathing or heartbeat has stopped, okay? And the CPR, you guys, is this motion on someone's chest. You're doing it on someone else's chest. You are manually pumping their heart. And in between pumps, you breathe into their lungs for them. So it is a manual technique to save someone. Do not ask me what CPR stands for because I don't know. And you'll find that a lot of these technical words that we use when we use an acronym in English, we don't often know the reason behind the acronym because it has effectively replaced the word. Although I think someone just entered it. Cardiopulmonary resuscitation. You know, if you learn CPR, you're going to be good. You don't need to learn the whole thing unless you want to. Okay, number 3, critical condition. And if you watch medical shows, you definitely know this term. Every episode of Grey's Anatomy, we have a patient in critical condition. Yes, A, very sick or injured and likely to die. So critical condition is just saying it's not looking good. And usually in these TV shows, this is what they focus on, is like these patients who seem like they're definitely not going to survive, and then due to a miracle or the good doctor, or Dr. McDreamy. Is this Grey's Anatomy? I'm trying to do my Grey's Anatomy references, but it's been a while since I watched. Anyways, the point is that they usually deal with someone in critical condition. Okay, dehydrated. E, good. So it's funny, you might say to me, dehydrated, is this a medical term? It is a medical term. We will use this in regular life as well. But it is something that we also use, it sort of has been adopted into common language from medical language. So dehydrated is when the normal water content of your body is reduced. And it's to a point that it's unhealthy. So it's a condition that you can have if you're outside in the heat for a long time and you aren't able to drink water, you may get dehydrated. Symptoms of dehydration could include dizziness, or an inability to think clearly, and headache. All right, number 5 is obviously C, a false positive. And I think people have gotten more familiar with these terms since COVID, because a lot of the articles about COVID testing have focused on the question of false positives or false negatives. So here I did false positive, which is saying a test that wrongly indicates an illness. So it says you have the illness, but you don't. When you take another test, it's negative. So the first was a false positive. I also could have put false negative, and then false negative, the definition would have been a test that wrongly indicates not having an illness or disease. I see Nasima saying, do we pronounce the H in hyper? Yes, we do. Hyper. That's a very good point. We also don't say hyper or hyper. It's hyper. All right, you guys, thank you so much. We're almost done. Today was really focused on some common medical terms, some vocabulary, really just the beginning of the rich jargon that is medical English. But the last thing we're going to talk about today quickly are a little bit on the communication side of things. So what does it look like when people are communicating or using English in a medical setting? So I think this is not surprising that doctors and healthcare workers are using general English with patients. So they're not necessarily using medical English. They're using general English to introduce themselves, to speak with them. They'll ask direct questions like, how long have you been having this symptom for? But they'll also ask open-ended questions such as, are you feeling any stress in your life? And since when did that start? Expressions and sayings. You guys, I said we still have 10 minutes left in class. You don't have to thank me yet. I sort of spoke too soon. But also thank you for saying thank you. So I have 6 expressions today, and I'm going to try to explain them all in the time that remains. Okay. The first one is out of shape. Out of shape. This is someone who has not been working out. They have not been at the gym, and so they don't have a good fitness level. So maybe I'm someone who I normally run, like I run 5 miles every day, and then I get sick, like me right now, I'm sick. So I stop running for 2 weeks, a month. At the end of the month, I'll say, oh, I'm out of shape. I can't run 3 miles. I'm out of shape. I can only run 1 today. Okay, it means I'm not at a high level of fitness. The next one is we'll need to run some tests. This is a common phrase that you'll hear from doctors when they need to diagnose you. So maybe they need to do an X-ray. Maybe they need to do an MRI scan. Okay, maybe they need to do a CT scan. These are different acronyms for the different tests that they might do. Maybe they need to take some blood and test your blood. For the tumor example, they might have to take what's called a biopsy and test the tumor. So we call this running tests. I'd like to get a second opinion, meaning, well, it can actually, the doctor can say this or the patient can say this. It means I want to consult another doctor. So if it's the patient saying it, maybe they say to the doctor, I want another doctor to confirm what you're saying before I move forward. If it's the doctor saying it, they might say, I'm not so confident that I'm going to ask another doctor to look at the test results and make sure that I'm doing a good job or my perception is accurate. Then we have on the mend. On the mend means healing. Healing. So when you're on the mend, it means I am healing or I am recovering from something. So whether it was an accident or an illness, it's a good thing. I'm slowly getting better, but I'm not better yet. Alive and kicking. This is something funny that we say to say the illness did not defeat me. I'm still here. So sometimes we'll say this in a very kind of jokey scenario. Like I could even say it now if someone calls me and they say, wow, your voice, you sound really sick. I could go, well, I'm still alive and kicking, right? Saying, I'm okay, I'm still here. But sometimes you can also use it for someone who's recovered from a very serious illness. Maybe someone had cancer, they underwent chemotherapy, and then they see the doctor 6 months, 1 year later, and they, after they've recovered from the cancer, and they go, you know what, doc, I'm alive and kicking, right? So celebration, the illness did not defeat me. And then the last one I have is to go under the knife. And this is an idiom that I think is pretty obvious because it means to get cut open, to have surgery. So you say, I'm having surgery on Tuesday, or I'm going under the knife on Tuesday. Sometimes we don't say it when it's very serious. We sort of say it when we want to lighten the mood. We want to make it kind of a joke or not so intense. Okay, guys, last thing I have for you is an idiom. An idiom, these are phrases that do not mean anything literal. Okay, they usually have a cultural basis for their meaning. So under the weather means, so the idiom is under the weather, and it means being unwell, being sick, or feeling worse than usual. It's not severe sick. It's like maybe you've just started feeling sick. It actually comes from maritime days, meaning from sailors or from boats. and they would go under or below deck, meaning not on the top of the ship, under the ship into their room. And this was called under the weather because they were not right on top of the ship, I guess. But that was interesting as a way to for me, is the first time I saw the origin. Here's an example sentence. You would say, I'm feeling under the weather today. I'm not sure what it is. Okay, this could mean like I have a headache, or I feel tired. I just feel under the weather. And then maybe the next day I realize I have a cold, or the next day I realize I have the flu. But under the weather means I just feel a little bit worse than usual. Okay? All right, you guys. Now that's everything. Now we've officially finished the class. Thank you for sticking with me. Next week, we're continuing medical English, okay? We're continuing medical English, and we will have a guest to be announced soon. We'll try to do some focus on mental health. We'll mention a little bit, maybe dental, maybe pharmaceutical if we have time. And I'll try to have more interactivity as well with the microphone if we can find people with good connection to share. Thank you for coming, you guys. Thank you for being such an interactive group. For those asking, this session is recorded and it will be posted on the US Embassy's YouTube page and the American Institute YouTube page. Okay? Thank you, and thank you for wishing me to get well soon. I appreciate it. Thanks for putting up with my scratchy or frog voice this whole time. All right, you guys, that is everything. Have a good rest of your evenings, and I'll see you next week.